Good morning. Welcome. Today I'm going to trace my leg lines or energy lines, give my lower leg a massage. So just starting with connecting my feet and opening up my hips a little bit, taking a look. The energy lines again in the body ride straight lines that come all the way up and in. 1, 2, this inner seam, 3 being the back seam of the leg, straight up the middle of the hamstrings. The outer one here will be directly up the front, tibialis anterior, knee, your quad, through the side seam of your pants. These will come up into the hips, and even just at that exterior angle hamstrings. It holds a lot of tension, so I want to make sure to get that as well. My feet and hands are a little dirty. I have been in the garden and my nails are a little long. Today is cutting day. So you can see that this won't be done with the tips of the thumbs fingers. We'll just move along with gentle thumb circles. We had a foot massage segment before, so today I'm coming up around the ankle, thumb circles. It feels really good right on the edge of the bone there. I'm going to start adjusting my posture, sitting more into my sit bones, breathing deep. Every time that we come to do this, even if it's quick, these segments I've noticed are about 15 minutes long. I'm going to come up and around my knee today, bring it all the way up. I'm even going to come straight up into the thigh. So this line here comes straight up into the hip, this outer top part of the quad, and instead of using my thumbs here, I'm going to go ahead and use the heels of my hands, that line, and press outward to roll the tissue open. And then we could even pull back a little bit. Just, it feels good. We'll warm that tissue up. We'll be coming to it later. Be a little bit different trying to get a hold of it. So I'll just smooth that out. We pressed on that line and now just smoothing for circulation and movement of the fluids, the lymph. Coming back down to the lower ankle, I went in the front side and I want to make sure to clean out that back side of the ankle, and I'm being very general because I want you to see that it's intuitive and should feel good, but there is a concentration to this fossa here just behind the Achilles tendon, and it's going to run up along the edge. And I know you can't see it as much, so me being flexible, I can roll forward. And it's this inner seam line in the belly of the gastrocnemius muscle. And you'll feel it, there's almost like an edge to it when you get up here, that belly. And then it attaches into inner adductor and hamstring attachment points right through the center of the knee. These circles, I'm taking them up, bring the tissue up and back to us as it kind of winds down with gravity so often. So I use different techniques, a little thumb circle, maybe partnered up with the top of my knuckles. It will strengthen my hand and my arm. I got goosebumps, it feels good. It feels like the right thing to do. But so that I don't overuse my hands and my hands get a different kind of exercise. And you can see I took that back down. I'll even take those knuckles, I'm sorry, that was like off the camera. Take the knuckles back off. The knee feels good, and even bringing them back down. And you can see that I'll use like a thumb to kind of hold my place as I work. I really like the right hand. We'll see if I use my left the same. But remember that any point of tension can be gone over multiple times. You know, you're breaking up that congestion to get the blood flow through there so the muscles can regenerate and breathe, that you'll even feel lighter for doing this. Always coming back to adjusting the spine, breathing deep, relaxing again, recentering. I'm going to be going through the back of my leg, and with this I can be pressing forward with my thumb presses. And I gently hold on with my fingers, but I can really get in between the calf back there, the gastrocnemius muscles, and start to separate out those tissues that work so hard. Excuse me. So I'm going to twist and wring out the lower leg. Bring the tissues in both directions. Kind of see how things move around, because I can. You can even kind of shake out the upper leg some. Now that third line back here, I wasn't able to press on the same way. So maybe as I open up my leg, I'm sticking my fingers behind my knee and just kicking my hand there to feel the tissue stretch and open. Now, if you do it with pointed toes or a flexed foot, it's two different feelings. One's a little bit more active, one's a little bit more passive, but that goes all the way up into the sit bone. So there's that. So just shake that out, maybe drag those tissues out as well. It's good. Into the knee again, make sure to clean it out, be gentle back there. There's a lot of nerve endings, veins, the arteries. So we're gentle around the sides of the back of the knee where everything's attached. Gentle to the middle, work harder around the outside. Health of the knee, very important. Most complex joint in the body, the way it moves and twists. So I'm doing just some holding of my quad and hamstrings, kind of shaking out the lower leg. Now to the outside of the leg, I have to sit back in my chair a little bit. I tend to get this one from, sometimes in the car, I again reach down to my legs, maybe when I've braked, and thumb press along that tibialis anterior. I'm doing this in the chair for all my people who have desk jobs and have to sit a lot, who may not get to the floor quite as regularly. You can see those thumb presses. I'm being pretty strong, moving the tissues. This muscle takes a beating from holding us up all day. So it can usually accept a lot. You can even spend a little bit more time holding out. This is a good spot up at the top where the belly of the attachment is, the insertion. It works really hard. These muscles are thicker up here and get smaller on the way down, but you may find some places that are a little